Are you able to see my presentation?
Yes, we can see it.
Okay, great. So, I'm Reem Karami. I'm currently a microsurgery fellow at MD Anderson, and I'm gonna give you this talk about surgical insight and what it's like to be a to be a female in plastic and reconstructive surgery. So, just a little bit of a personal history about myself. I graduated from the American University of Beirut with an MD in 2014. I did 1 year of internship in general surgery, and then I completed 5 years residency in plastic and reconstructive surgery, and I'm currently a reconstructive microsurgery fellow at MD Anderson Cancer Center. So, what is plastic surgery? Plastic surgery is a relatively very old field of surgery, with the first reports on plastic surgery dating back to 200 years before Christ in India. Sushruta is considered as the father of plastic surgery. He was the first person to do a forehead flap, and you can see a lot of his writings. And unfortunately, it wasn't until 1948 where Almadeya Morani female, was the first female plastic surgeon recognized in the United States, which is almost 2,000 years after the creation of the field of plastic surgery. She actually finished her residency in 1936, but was only recognized as a plastic surgeon by the American Society of Plastic Surgery in 1948. So, what is plastic surgery? To understand a little bit about plastic surgery, because I think most people have an idea that it's only cosmetic surgery, you need to think about how this field came into life. So, one of the great fathers of plastic surgery was actually a war surgeon who operated during the French War. His name is Ambroise Paré, and he did a lot of amputation surgery. He tended a lot to the wounds of the soldiers. Sir Harold Gillies is considered currently the father of modern day plastic surgery, where a lot of his flaps, a lot of his writings are still practiced till now. He was actually born in New Zealand, then trained in England. And this is a very famous picture that he shows of a sailor that he operated on, and he described a skin flap where he reconstructed his upper and lower eyelids. So the point being is that plastic surgery is not restricted to cosmetic surgery. Actually, plastic surgery, the name of the specialty is plastic and reconstructive surgery. It aims at correction of defects, restoration of lost function, and in addition to improvement in appearance. So, as a medical student, how can you get into the field of plastic surgery? I'm going to talk personally about my experience. I did my residency at AUB. I did 1 year, the program was a little bit different back then. I did 1 year of internship after medical school and as a general surgeon, and then I applied to a residency in plastic surgery. The program changed. Currently, you can apply immediately out of medical school and you get into a 7 year residency program divided into 3 years of general surgery and 4 years of only plastic surgery. During your first 3 years, you rotate almost 6 months every year in plastic surgery. In the US, if you're considering coming here for your residency, things are a little bit different. There are two different tracks that you can take. You can either go with the integrated program, it's a little bit more competitive. So, out of medical school, you apply immediately into a plastic surgery residency and you do 6 years of plastic surgery. Versus the independent program, it's where you go into 5 years of general surgery. After you finish your general surgery training, you apply for a plastic surgery sort of fellowship where you only do 3 years of plastic surgery. Uh, Either or you become a board certified plastic surgeon after that. So, a little bit about the do's and don'ts, specifically talking about females in this field. So the first do is the 3 A's. I think this is very important, not only in residency, but when you start building your career and in life in general. It's always important to be available, affable, and able. Availability meaning that whenever someone consults you or asks you for something, you should be available, especially when you're starting your career. Affable, meaning you have to be likable, and ability, meaning that you have enough surgical skills and decision making that that you can become a surgeon. It's really important to work hard. I know that a big part of the plastic surgery training is going through general surgery, with I think the minimum is 1 or 2 years of general surgery, regardless of what pathway you choose. And it's really important to benefit out of the days in general surgery. Honestly, a lot of people don't like general surgery, or they only see it as a way of getting into plastics. But honestly, no surgery should be disregarded. I learned a lot from open heart surgery. I learned a lot from abdominal walls, from breast surgery, all of which I did during my training as a general surgeon. Um, it's also important because you get a lot of training in intensive care and trauma, and which eventually really helps you a lot during your years in plastic surgery. It's really important to find a mentor. It doesn't have to be a plastic surgeon. It doesn't have to be someone in Lebanon. It doesn't have to be someone who's in your program, but just find someone who can help you, who can guide you, who you can turn to when you have questions or are in doubt. This is a long residency. You're talking 6 or 7 years. It's really important to find friends during this residency. Honestly, one of the greatest friendships I have were through my residency program. It's really important, though, to maintain your level of professionalism with them and to set boundaries. You should not allow your friendship to come into the workplace and affect your decisions while you're working. A little bit about the don'ts, and when I say the don'ts in this specific situation, I'm talking about women. You should not let the fact that you are a woman affect your job, and this goes both ways. So do not overwork yourself trying to prove yourself, trying to prove that you are as good as the male surgeons, or that you are better, or that you are more hardworking. Just do your job, do what you're supposed to do, and do not tire yourself. And then the other extreme is also do not play the role of the victim. Do not dramatize situations. Do not let the fact that you do not use the fact that you're a female um, um, to help you get out of situations and deal with stuff. Honestly, during my whole 6 years during my residency, I never at once felt that I was treated differently, neither by my mentors, my faculty, or my co-residents, or the nurses, or the OR staff, by the fact that I was a female. Um, so I think that's really important to not let that fact affect you. And most importantly, do not become a victim of your achievements. I think it's really important to find hobbies, to have a social life, to have friends, to read a good book. I mean, you come out of this residency in your early 30s, and you really don't want to start discovering who you are at the age of 30. So it's really important not to really maintain a normal lifestyle outside of your residency program. Okay. The most important thing is try to not burn out. Really give time to your family, give time to your friends. It's not bad, and it doesn't make you any less of a surgeon if you do. I really recommend this book, honestly, to anyone who is going into the medical field. I read it at the end of my internship year, but I think you should read it before going into the internship. It's called The House of God, and it's a classic novel by Samuel Sham, who's a psychiatrist. It's a comical novel about how life is during your first year of internship. Now let's talk a little bit about plastic surgery and what do they tell you and they don't tell you about plastics. Plastic is a very diverse field of surgery. Um, Whenever anyone says plastic surgery, especially in Lebanon, I think your mind goes into cosmetic surgery. And I would say that most of the plastic surgeons practicing out of Lebanon are cosmetic surgeons, but there are many, many, many different fields of plastic surgery that I think anyone who is going into plastic surgery should be aware of. So I'm going to go over each and every one of them a little briefly to help you just understand what plastic surgery is. So for sure, cosmetic surgery is a big part of plastic surgery. You can pursue fellowships either in facial plastic surgery, doing facelifts, blepharoplasties, rhinoplasties, or fellowships that are specifically related to body contouring, like arm lifts, thigh lifts, abdominoplasties, breast surgery, and of course, injections, Botox, fillers, and lasers. It's really important to recognize that as plastic surgeons, we are hand surgeons. During my residency, we used to alternate calls with orthopedics. People used to be like surprised when they come in with a hand fracture and the plastic surgeon is taking care of them. So we don't only do soft tissue reconstruction to the hand, like and tendon repairs, but we also do bone fractures. We do phalangeal fractures, metacarpal fractures. In some programs, they even do distal radius fractures. And something that only specifically plastic surgeons do is they treat amputations and they do lots of replantations. So this is just a few pictures showing. This is one of the patients who had an injury to his flexor tendon, and we were able to repair the tendon. And I would say that plastic surgeons and specifically deal with these injuries more than orthopedic surgeons. Another big branch of plastic surgery is breast surgery. Whether it's cosmetic breast surgery, such as breast augmentation or breast lifts, or functional surgery, such as breast reduction or breast reconstruction. So breast reduction actually is a functional surgery. It helps patients improve. It helps patients who have back pain, who have skin changes because of the large breast size. It's actually covered by insurance companies, this procedure. And then a very big field of breast surgery is breast reconstruction. It's a very big topic, and it's some fellowships actually only deal with breast reconstructive surgery. Another field of plastic surgery is craniofacial surgery. And if you are interested to go into craniofacial surgeries, there are some fellowships that are only adult craniofacial and they mostly deal with trauma surgery. We usually work with our colleagues in head and neck to deal with mandibular fractures, maxillary fractures, orbital fractures. If you look, then the other branch of craniofacial surgery is with the pediatric age group and specifically treating congenital anomalies, mainly cleft lip and palate, craniosynostosis, cranial remodeling. We do a lot of ear reconstructions, a lot of eyelid reconstruction for congenital ptosis. I don't know if you know this movie called Wonder, starring. It is the story of a young boy who has Stretcher Collins syndrome, and you can see, as in this picture, the previous picture. This is the Tessier cleft classification, and Treacher Collins is one of them. And really, these diseases affect children, affect the way they grow, how they interact, and it's really something rewarding to be able to help these little kids. This is another example of someone who has craniosynostosis. So we work along with neurosurgery to help reconstruct the orbit, not only from a cosmetic standpoint, but also to help these patients usually have problems with increased intracranial pressure, causing a delay in speech. And so it's really important to recognize them early and to treat them. Burn surgery is another big field in plastic surgery. So usually the burn unit is an intensive care unit that is run mainly by the plastic surgeon. So the plastic surgeon is the intensivist. Acute burns are extremely morbid. You need to know how to manage fluids, how to treat kidney injuries, how to manage nutrition, how to perform tracheostomies. And then there comes the different field of treating chronic burn injuries. So if not treated properly, many of these burn patients develop contractures and functional problems in the future. So I'm showing a couple of pictures. This is a child who had a severe burn on the neck and that wasn't treated properly. He developed hypertrophic scarring. And as you see in the first two pictures, this kid is unable to extend his neck. He is unable to move. He's in a lot of pain. These scars cause a lot of itching. So We released his neck and we were able to reconstruct it so that he can extend it at the moment, and he is still being treated to treat the rest of his scars. This is another kid. I know it's simple. He had a small burn on his foot, but the second and third toe retracted, and you can imagine how difficult it is for him to be able to walk properly, to wear normal shoes. And so this is all part of plastic surgery. Um, Microsurgery. So this is my field. I'm doing currently a fellowship in microsurgery, and I consider microsurgery to be one of the most complex and most difficult fields in plastic surgery. This is actually a picture of me and one of my co-fellows. Microsurgery is defined as surgery using the microscope and fine surgical instruments. So the concept of it is that we transfer tissue from one part of the body to the other, whether in trauma, whether it's for post-cancer reconstruction. We do a lot of head and neck, a lot of breast, a lot of extremity reconstruction. And the whole point of it is to transfer this tissue with its blood supply and to re-anastomose the blood supply into the new area. And these blood vessels are usually very tiny. You're talking maybe on an average 3 millimeters, and this is why it needs to be done under the microscope. This is an example of what we do. So this is an young gentleman who had a cancer in his mandible, and his mandible had to be taken out. And you cannot leave someone without a mandible, so you need some sort of bone to reconstruct it. So you harvest the fibula, from his leg. You plate it. You see the osteotomies. You cut the fibula out. You plate it in a way that fits the jaw, and then you transfer it up. You fix it in place, and you hook up the blood supply. Because if you don't, then obviously this transferred tissue will not survive. This is another picture of a young lady who had her palate removed. What we did, we got this piece of skin, fat, and a small piece of muscle, and this is the pedicle, this is the blood supply, and we hook it up in the neck. I don't know if the picture is clear, but you can see this is the anastomosis, and then we use this tissue to close up this patient's palate. Um, Honestly, women are very much supported in the field of microsurgery. If you look at the American Society of Reconstructive Microsurgery website, there is a specific group called the Women's Microsurgery Group, who are very active group. They have a page on Instagram if you want to follow them. They support women in microsurgery. They have yearly events. They have grants, and if you're interested, you should follow them and keep up to date with their news. A new field of microsurgery is lymphedema surgery. So also when people say lymphedema, most people think that this is treated by vascular surgeons, where in reality this is treated by plastic surgeons. Lymphedema surgery, or otherwise known as super microsurgery, because we're dealing with vessels that are zero point 0.3 millimeters. So these vessels are thinner than a hair. This is a recently relatively new field that has been present over the past 10 years only, and that is because of recent advancement in the operating microscope and in micro instruments. And pioneers in that field are mostly in the Far East, in Taiwan, in Korea, and in Japan. And I'm just showing you a picture. So these are the three lymphatic channels going into one vein, and you can see after we do this lymphatic surgery how the blue color flows into the vein. This is the final field of plastic surgery that I'm going to talk about, and it is peripheral nerve surgery. Also, I think a lot of people do not know that plastic surgeons do peripheral nerve surgery. Actually, the pioneers in the field of peripheral nerve surgery are two female surgeons, Dr. Susan McKinnon, who operates out of St. Louis in Washington. She still has a fellowship program specifically for peripheral nerve surgery, and Dr. Julia Terzis, who is, I think, currently retired, but she used to operate out of New York. So we do a lot of nerve decompressions, um, and brachial plexus surgery. And even though it is thought that neurosurgeons do that, it is specifically as field in plastic surgery. Okay. There is a lot of room for innovation and growth in plastic surgery. Robotic surgery is a relatively new field where we are doing minimally invasive abdominally based flaps for breast reconstruction. We're doing minimally invasive head and neck reconstructions. Um, so I think there is a lot of room to grow there. And another big field of plastic surgery that is also relatively new is transplant surgery. This is a patient who had, he was one of the first face transplants and out of Mayo Clinic. And actually it was pioneered by a Lebanese surgeon who actually visited AUB a couple of years ago. His name is Dr. Merdini. I don't know if you recently heard also about the double hand face transplant, and it's really important to know that it is actually plastic surgeons who are doing these procedures. And that's about it. I hope I gave you a good overview about what plastic surgery is and how to pursue a career in that. And I open now the floor for questions if you have any.
Thank you, Dr. Reem, for this comprehensive session. If anyone has any question, feel free to unmute your mics or just drop them in the chat box.
Okay, so I have a question in the chat box. Two questions actually. The first one is, how do we feel that people inside and outside the medical field look down on plastic surgeons? I don't think that's true. I think there is a general conception that plastic surgeons are cosmetic surgeons and they mostly do fillers and Botox, and I think we are trying really hard to change that conception. Um, all of my co-residents, people who graduated before me, people who are graduating after me, are trying to go into different fields of, into all these different fields of plastic surgery. I think maybe in Lebanon, the situation is a little bit different, but if you go outside and you see plastic surgeons, I don't think anyone looks down on them. The second question is, how do we affect our affability? I sometimes have people that don't like me due to no apparent reasons. I think the most important thing is to be professional and to do your job. If people have issue with you personally, it should not come into the workplace. Um, and I think like if you just are very professional and always get the job done, I don't think people would not like you. Another question is, what is the most exciting surgical procedure in plastic surgery? I think microsurgery specifically. I love doing microsurgery. I know they're long procedures. We're talking about an average of 6 to 8 hours. I think I showed, this was one of the complex cases that I did that I'm doing in my fellowship. And I think procedures like these, where you are able to really help patients restore function, like without this mandible or without this palate, these patients would not be able to speak, they will not be able to eat, they will not be able to get to go out in the public and be accepted. So I think what I personally like the most is reconstructive microsurgery. Okay, it doesn't look like we have any more questions.
Okay, thank you, Dr. Reem, again. It was indeed an amazing session. And thank you, everyone, for joining us. See you next week in our last surgical insight. Goodbye.
Thank you for having me.
Thank you,
Bye.
Dr.